Thank you, Mr. Speaker, and I'm pleased to rise and say a few words about the pressing issue of the state of our emergency departments. We just heard from the government that we should be here only discussing the matter of MLA pay raises. And with respect, and as far as I can tell, contrary to the wishes of the government, the passage of this emergency debate shows that that is categorically false, and that in fact, the state of our emergency departments fit the definition of a matter of pressing public concern that need to be debated by the House at the first available opportunity. We have been debating it the last few days, but we will continue to, and we should continue to. Earlier, my colleague from Northside Westmount said, we're all here for the right reasons. And I agree with that statement, and I believe it. I think people put their names forward for public service because they want to serve and they want to make a difference. And I guarantee you, Madam Speaker, that every one of us in our office has more heartbreaking stories about what's happening in our healthcare system than we could possibly tell in this chamber. And it's a systemic problem. There's no question. And I think we can say it's a systemic problem without immediately moving to cast blame. But unlike any other election campaign that I've seen in my political life, this government ran a campaign on a single issue, one issue, and that is to fix healthcare. They were clear, they were decisive, they were repetitive, and they won a majority government, and they were given a mandate to fix healthcare. And here we are a year later, and healthcare is worse. As we've talked about, it's worse by every measure. More than 25,000 people added to the wait list for a family doctor, not because they think now being added to the wait list is useful because maybe they'll get one. That is one of the strangest arguments I've heard put forward in this chamber. No, why are they on the family wait list registry? Because they need a doctor. They need access to primary care and they don't have it. And we know that there's a multiple of that number. So for 100,000 people on the list, there's that many more, probably twice as many, who aren't on the list, but don't have access to primary care. We know that the number of people leaving the emergency department without being seen is up 60%. The member for Halifax Atlantic, I think, mentioned earlier today that someone with a broken wrist was sent home and told to come back. My 9-year-old broke his wrist last summer, and we were just talking about it because he's going, shows you the kind of parent I am, I guess. He's going back to the camp where he broke his wrist last summer, but we'll hope for better outcomes this year. But I was talking to, and he said, oh God, Mom, this year I promise I'm not going to break my wrist. And I said, okay, Sam, I believe you. I don't think you're going to break your wrist. But we were talking about it, and I was trying to remember what happened when he broke his wrist. And I said, Sam, do you remember? Because anyway, my mind's kind of like a sieve these days. So I said, what happened? Do you remember? And he said, yeah, Mom, remember you picked me up and you picked up the girls and you dropped them off and the babysitter came and then we went to the emergency room. And I said, yeah, and like we waited a long time, right? He said, yeah, we waited for a while and then they put my cast on and we left. And from that perspective, it was kind of unremarkable. Like I don't really remember, which is kind of how it should be. If my child breaks his wrist, I need to know that I can take him to an emergency room and get the wrist set. And I need to know that I can do that anywhere in this province. If the IWK has the waits that we've seen, what of the other emergency departments if they're open? So Madam Speaker, this is an emergency. We know that our emergency care system is still functioning. Frontline workers are still working. If Sam breaks his wrist again this year, which I really hope he doesn't, we'll go back to the IWK and we'll wait as long as we can. And I have a good amount of faith that eventually his wrist will be set. But I shouldn't have to hope that that happens. I should be able to know that that happens. And as we spoke about in the chamber the other day, Evelyn Hornbeck doesn't have a family doctor, can't get the medicine she needs, can't get to a walk-in clinic. Vicki Gray waiting for carpal tunnel surgery, can't use a doorknob, can't lift anything, can't zip a zipper, looking at a wait of 2 or 3 years. So are things happening in the healthcare system? Sure. But that doesn't mean that we can ignore the fact that things are bad. And I would like to hear from the government what is being done right now that's going to alleviate some of the deep fear that people are facing when they're trying to access basic health care. And one of the things I want to say is that I turned on the CBC radio the other morning, and the health hack was how to access private health care without breaking the law. That was a health hack on the morning news. How to access private health care without breaking the law. This is a well-documented process. Things get so broken that it suddenly appears that only the private sector can fix it. And beware. You know, I hope that I don't have to revisit the words that I'm speaking right now, but we are at a dangerous crossroads in our healthcare system. People are losing trust in their ability to find health care. We talked about Spencer Thomas, who tried to go to 6 walk-in clinics. He tried to go to a public clinic, to a private clinic, and they wouldn't take him because his kid was too young. But he would have done it. Why? Not because he's a bad person, not because he doesn't believe in public health care, because he was desperate. He had no other choice. So, Madam Speaker, the idea that it's not appropriate for us to be discussing the state of our healthcare system right now in this chamber is frankly offensive to all of the people that we represent. We know that it's getting worse and worse. And so what do we do about it? Well, we've heard that there's progress being made. We've certainly seen some announcements that we're happy about. New seats for nurses is great. Guaranteed employment is great. But the reality is we are in a global competition for healthcare talent. And I thought we all knew after Premier McNeil ran on a promise to deliver a doctor for every Nova Scotian and was unable to do that, that wasn't actually going to happen. It's not going to happen. We're not going to have a doctor for every Nova Scotian. But we need to know, and Nova Scotians need to know, and everyday people and families and seniors across this province need to know that when they need access to care, they can get it. And so how do we do that? Well, we haven't heard a plan. We know that the government tabled a plan, but it didn't talk about what the future of primary care was. It didn't talk about how we're going to do things differently in a time when our population is growing, when we know that as a province we are older and we tend to be sicker than much of the rest of the country, when our healthcare transfers remain, frankly, insufficient to cover the costs of what we need to do. So what are we going to do? Well, we have to do things differently. And one way that we could do things differently is to think about a different way to run our public healthcare system. And the NDP embarked on this path when we were in government, and that's collaborative care. That's finding a way that people can access primary care and emergency care without necessarily having to have fully staffed facilities with physicians all the time. We can use paramedicine, we can use nurses, we can use nurse practitioners, we can use physician's assistants. We can use non-medical personnel to do certain tasks that may not require medical training. These are things that could happen now, but what we're hearing, in fact, is a move away from that model. So what's the plan? We don't have enough doctors. I think it's great that there's an emphasis on recruitment, although last I heard, the head of recruitment mysteriously disappeared and we haven't heard why. Notwithstanding that, great, recruitment, it's not enough. It's not going to fix the problem. So what's going to fix the problem? We need a new approach. We need to know that it's happening. It's not enough for us to hear that seeds are being planted. If I hired a gardener and I said, how did things go out there today? And they said, seeds are being planted. My next question would be, what seeds? Like, what's going to come up? What is my garden going to look like? Are you planting swamp milkweed so I'll have a bunch of butterflies? Are you planting gout weed so that I'll be upset for the rest of my life every time I go outside my door? Like, I don't know. I don't know what seeds are being planted. We're just being told that we should trust that seeds are being planted. And those seeds are being planted by 4 people, or maybe 3. I don't know what's happened to Dr. Orrell. And frankly, without any transparency, without any clarity, without any conversation about what this innovation looks like, it's very difficult for us and for the Nova Scotians we represent to have faith in this. So yesterday, the minister seemed to suggest that in response to a question about the overcrowding at the IWK, that parents might not be used to having sick children, or children might not have been used to going to the emergency room. And I found that response really troubling. As a parent of 3, my strong belief is that if you feel like there's something wrong with your kid, you go to the hospital and you get it checked out, because you never know. You never know. I'm not a doctor. If I think my child is sick, I take them to the hospital, and I should be able to expect that they will get care there. And so I think that goes for all of us. I think when we are sick, when we need medical attention, we should trust that we can get the help we need. And there are a lot of steps that could be taken to accomplish that. I think moving to a different model, as I've discussed, is one. I think actually looking at wages, not just of continuing care workers in long-term care, but of people throughout our medical system, is another. And more generally, with the disposal of an entire government department, we're asking the question, what seeds are being planted? When are they going to grow? How long do Nova Scotians have to wait? So I hope we get answers to that. I'm glad that we have the opportunity to talk about this in the chamber tonight, although I know it wasn't on the government's agenda, and I look forward to hearing the comments of my colleagues. Thank you.